Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Joe Flanders from Numinus Wellness Incorporated. It's a Canadian-based company. He's joining us to talk about psychedelic-assisted psychotherapy and how Numinus has completed its first MDMA administration in a PTSD trial. Welcome to Health Professional Radio, Dr. Joe Flanders.
Thanks so much for having me.
Tell us who Dr. Flanders is and how you got into this practice.
Yeah, so I'm a psychologist based in Montreal, and I've been in practice for, I think, about 12 years now. And I've always been really passionate about well-being generally. I think as a young person, I was really focused on understanding myself and my own triggers and stresses and stuff like that. And as a consequence, did my best to kind of explore and understand the best tools and practices and ways of being to maximize my own health and well-being. And as I matured and became an adult, really wanted to find ways to, leverage these things that I was learning and help other people. And I was really into things like cognitive behavior therapy early in my career. I got really excited about mindfulness meditation and made that the thrust of my practice for many years. And when I came across the possibility of psychedelic-assisted psychotherapy, it was just kind of an irresistible professional path for me. And so a number of years later, here I am.
Psychedelic-assisted psychotherapy. What is it? Who benefits from it? And is it safe?
Yeah, so we're kind of living right now what's called the psychedelic renaissance. So it's the reappearance of these compounds in our society after, a number of different kind of entry points over the last, decades, if not more. And what it is, it's actually just totally fascinating. So it's a combination of pharmaceutical. So a psychoactive drug is prescribed and administered with medical support, and combined with the presence of a highly trained psychotherapist to really create kind of the best of both worlds, where you have this tool, this catalyst that opens up neuroplasticity or the possibility of new ways of thinking and feeling. And then with that open window, bringing in the powerful change processes that we've been working on kind of developing in the field of psychotherapy. And it can really accelerate and help people achieve profound change and transformation. And it's quite an exciting development in our field because, as your listeners I'm sure know, there are many, many millions of people that need help. And the current tools that we have are quite limited. So it's very exciting. You asked me how many, who are the people that this approach can help? And I do think ultimately we'll find that they can be helpful for a broad range of conditions, different aspects of human experience. But for the time being, the research is sort of most developed. We have the most evidence for things like MDMA-assisted psychotherapy for the treatment of PTSD, psilocybin-assisted psychotherapy for the treatment of depression, and addictive disorders as well. So those are the three leading indications. And as I said, I think we'll see many more indications and many more stressors and life problems becoming relevant to this field as well.
You mentioned different compounds, 3 different compounds for 3 different conditions. Are these compounds used only in attempting to treat these specific conditions, or can they be used interchangeably?
Yeah, it's a great question. I would say, again, probably in the long run, they might be used interchangeably in a way that different approaches to psychotherapy can be applied to different types of problems. But for the time being, where we're at in the field is that companies like MAPS and Compass and some of the big kind of drug discovery initiatives are trying to get the FDA and Health Canada and other governing bodies to approve these treatments. And so what that means is you have to choose one compound, you have to choose one indication, like one mental health problem, and demonstrate through very rigorous scientific study that they are safe and effective treatments. Once, these initial ones cross the finish line, which I believe they will, sooner or later, I think the field may open up and there'll be new combinations and new possibilities.
MDMA for PTSD. I understand that you've completed your first MDMA administration for PTSD. Why does MDMA lend itself toward PTSD specifically? Or I understand what you just said, we're in trials to see what's going to happen, and maybe in the future we can, mix and match. But what is it about PTSD and MDMA that go together?
It's a really good question. So first of all, I'll say that, the clinical trials of MAPS are quite advanced, and we're into phase 3 now. And so there's been quite a bit of evidence accumulated in these trials. And there's, I think, emerging a pretty good understanding of how they work and why MDMA is really helpful for PTSD. And my understanding of it is that, when people experience a trauma and have these post-traumatic stress symptoms, one of the big problems is that their nervous system is in this hyper-alert state. And it's very difficult for people suffering from PTSD to think about, reflect on, process the traumatic memory, and people get really stuck. Very little healing can happen when the nervous system is stuck like that. And what MDMA is really, really effective at is helping people feel safe, helping people feel resourced to reflect and process things, and maybe most importantly, helping people feel connected to their therapist. And so there's a sense of safety and connection. And in this context, people can really get unstuck. They can feel that connection. They can feel cared for. They can feel resourced to process what happened and really get the nervous system unstuck. And I can say that I've seen that with my own eyes, and it's quite a remarkable experience.
What about someone who's dealing with PTSD, who's younger, but they've experienced some type of trauma early in life? They're now preteen or teen. Is this something that's going to be considered as we seek approval for these methods and these compounds? The truth is, I don't really know. Okay.
I think that if I'm going to reflect on the adolescent brain, I know that it doesn't really stop developing for the age of 25.
Okay.
So I'm going to be really, really careful about administering any psychoactive substances, especially ones as powerful as psychedelics, to someone who's under 25. I'm not going to close the door, but I'm going to wait for a pretty significant amount of research before I make a decision like that. And I think it does speak to your question earlier about safety, which I can speak to now, or happy to take a different question if you want.
No, you can speak to the safety and tell us what's next for Numinus as far as this trial.
Sure.
And when do you think it'll be completed?
Sure. So I think this question around whether young people can be eligible for these kinds of treatments. And we know, again, it's not like adolescents and young adults out there don't need support, and the levels of anxiety and depression and even suicidal ideation and suicidal tendencies are on the rise. And so we do need new tools and new ways of approaching that that problem that's at a pretty significant scale right now. But, we need to be, the research is really clear that when these compounds are taken, administered in a setting that's thoughtfully put together with caring professionals, they're incredibly safe. There's very, very little to worry about there. The challenge is when people consume these compounds recreationally and they're not as thoughtful about the environment that they're in, their people that are surrounding them. And so this is why training is extremely important, and that regulation is really important, that the treatments are sufficient research is done, that the FDA and Health Canada, evaluate the data, and that it passed through all the same gates that most, pharmaceutical discoveries pass through, and that we develop expertise and that we learn how to scale these protocols in ways that are safe and therapeutic. And, one thing I could speak to in terms of where Numinus is headed is we've recognized that, again, given the scale of problems like PTSD and depression in our society, we need solutions and treatments that are going to scale to help millions and millions of people. We think we have an incredibly powerful intervention here that could help millions and millions of people. But there's a massive bottleneck and a massive shortage in the trained therapists who can deliver the stuff. It's not a pill that your family doctor gives you and you take every day and you come and see him again in 6 months or a year. This is an intensive psychotherapeutic intervention, and you need highly skilled, highly trained therapists. Again, this is something that I'm personally working on at Numinus and developing a certificate pathway for therapists that want to learn how to do this stuff. And we think it's incredibly exciting because it's an incredibly inspiring moment to be a therapist. And it's also incredibly important that we train people properly so that people are safe and getting the therapy that they need.
Give us a website where we can learn much more about Numinus.
Yeah, so pretty straightforward. Check out Numinus.com. That's Numinus.com. And there's lots there about our research, our clinical activities, and the training programs that we're launching this year.
Well, Dr. Flanders, I appreciate you joining us here on Health Professional Radio. Thank you so much for your time.
All right. Thanks a lot. Take care.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Joe Flanders. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.